I'm Dr. Rishi Anand. I'm the co-medical director for the electrophysiology program here at Holy Cross Hospital. Here to talk to you all about stroke prevention and some of the new innovations and technologies that we're employing for our patients who have atrial fibrillation and are at risk for strokes. One of the new tools that we have is called the Watchman Device, and this is a nifty device. As you may know, a lot of our patients who suffer with atrial fibrillation, one of the dreaded complications is that they can have a stroke. In fact, 1 in 5 patients who have atrial fibrillation in the United States are at risk for a stroke, and these strokes are not minor by any stretch of the means. In fact, they can be quite devastating. Until about 10 years ago, we were treating these patients with blood thinners such as warfarin therapy or Eliquis or Xarelto or Pradaxa. And while these blood thinners have been life-changing for some patients, they still carry risks, namely bleeding risks. Since the advent of the Watchman device, we have the ability through a minimally invasive procedure to place a device inside of the heart in the portion of the heart called the left atrial appendage. That's where strokes tend to come from when you have atrial fibrillation. By placing this device inside the left atrial appendage, we're able to effectively exclude the left atrial appendage from the rest of the heart and thereby prevent any clots that have formed inside of that appendage from dislodging and embolizing into the rest of the patient's body, such as their brain or other parts, and therefore cause a stroke. The procedure itself has a very low risk, usually a 2 to 3% risk for a procedural complication, and it takes us literally 30 to 45 minutes. A lot of my patients who have the procedure performed will be discharged either on the same day or the following morning, and we only ask that you do no heavy lifting for approximately 48 to 72 hours. So the Watchman procedure is a great advance in medical therapy, and it has allowed a lot of our patients who do not want to be on a lifetime of blood thinners an alternative option for coming off blood thinning therapies and allowing them to live their life to the fullest.